Hi, I'm Shannon Eller from Both Sides of the Couch. What we're going to talk about today is ethics. I know that ethics is either a subject that strikes fear and dread in counselors' hearts. Sometimes clients are not even aware that counselors have an ethics code that we have to adhere to, but we do. And so I want to talk about this for just a little bit and let you know that the workshop that we have is designed to be very interactive, very informative. And if you decide that you would like to do your ethics training with us, please give us a try, because we have a lot of things that I think will give you a different perspective in your own practice. If you look at any ethics code for the social workers, the MFTs, the licensed professional counselors, addictions counselors, supervisors, group counselors, they all basically say the same things. We are, as clinical mental health professionals, required to adhere to ethical standards and clinical standards, legal and moral standards for client care. And most counselors are really concerned about what issues are, before the board. The biggest issue before the board mostly is competence, staying in our own level of area of our expertise and our scope of training, and confidentiality. We have to look at ourselves as counselors, as clinicians. Where do we come into the counseling arena with the client? Educators, supervisors, advocates. How do we learn who our client population is? How to best advocate for those that we see? If you're a client and you're coming in from a less than majority perspective, and that goes across the cultural continuum, it's not just culture, race, and ethnicity. It's age, it's physical ability or disability, sexual orientation or preference. It's also other types of things, our faith system, the families that we have. Many things play into the cultural continuum. If you feel like that you have not really been heard, or there's not a place for you that's open and welcoming for a counseling center, this is the place for you to come, because we adhere not only to cultural diversity and competency, but also to ethical standards for treatments for all clients. So you want to ask yourself who the stakeholders are. And we want to adhere to the clinical principles, the ethical code principles. Beneficence, do your client good. If you come to see us, we're going to do our very best. Everything may not always be okay, but it can be better than it is. Non-maleficence, avoid doing harm. Justice, be fair. There's a power differential between counselors and clients. Autonomy, if you come in as a client, you have your own choice, your own free will. We're not going to impose our values and will upon you. You have a right to make the choices that are best for you. What we do in counseling is try to help you determine what you feel like would be the best course of action for you to take. Fidelity, which is truthfulness and faithfulness to the profession and the procedures, to the process, to add up for client welfare. We do have times that we have to go to court with our clients. When you hear some of the things that we do for our courtroom procedures and the things that we require from you, those things are there to ensure that we are providing ethical, clinical, and legal standards for your level of care. Counselors are typically judged on what is usual, customary, and reasonable, UCR, for other professionals in their field with their level of education, their clinical expertise, and their demographic areas. So as you're a counselor and you're going through this, all of these things are provided within our ethical PowerPoint for you, with cultural issues, multicultural issues, knowledge, awareness, skills. Those are things that we can easily teach other people, we can gain for ourselves. It's a little bit different to gain sensitivity and respect. Those things have to already be embedded. So competency issues, expertise, referral, terminations, and abandonment, all of those things are in this workshop that will help you. Excuse me. If you are a counselor, I want you to know that we have an ethical inventory along with the answer key that is developed by Gerald Corey that will help you